My name is Christian Ocampo. I'll be doing my video validation on some NG2 care. So the first thing that you should do before interacting with your patient is to do the 7 steps. First things first, you want to introduce yourself. You want to ID your patient. Here we have Miss June, 28-year-old female, which is seen here on her ID band. And you want to ensure privacy. You want to get equipment, which consists of Toomey kit with some saline in it, and pair of gloves, stethoscope. You also want to double check the physician's order, which I have done, NG2 care every shift. You also want to explain the procedure to your patient. Then you also want to practice hand hygiene. So the first step is to bring the bed up to working level. That's good. Then you want to elevate the head of the bed to about 30 degrees. About 30 degrees. Then our next step is to assess the basal site for any tube dislodgement, redness, rashes. So in this case, it looks pretty good, so we could just move on. I'm going to put a barrier right in between where the suction is, right where the suction tube and the NG tube connect. Right underneath. It may or may not get messy, so use your own judgment for that call. I'm going to turn off the suction. I'm going to don on some clean gloves. Our next step is to see where the placement of our tube is. Bring this down momentarily. Want to place your diaphragm over left of the xiphoid process, and with your syringe, you want to take about 10 to 20 cc's of air, or mLs as we say nowadays. And we're going to instill it into the nasogastric tube. So I disconnected while kinking. There. That holds that in place. And we're going to place our diaphragm just left of the xiphoid process, which is right around here. And then we're going to gently. Okay, and you're going to be listening for a whoosh. In my case, I did hear a whoosh, so I know my placement's good. If you don't, try a second time. And if you don't hear it again, obtain a stat X-ray order to verify NG2 placement. So after verifying the placement, we're actually going to aspirate just a little bit of the gastric fluid. Just a little bit. And you may have to test the pH of it. In this case, I have to, so I'm just going to take whatever I just pulled out. I'm going to put on my pH testing paper. And I'm going to check the acidity to make sure it's less than 4. Place that right here. Since it's less than 4, we know that it's good and it's actually in the right place. Our next step is that using our Toomey syringe while kinking it, we're going to take in about 10 to 20 mLs of normal saline. But because it's a mannequin, I'm not actually gonna put real saline in there, or anything for that matter. So in this case, we're gonna unkink it and push in In this case, I have 10. I'm going to push in 10 cc's, and then I'm going to pull out 10 cc's of gastric juice, or gastric fluid, as some may call it. So once we pull up the gastric fluid, you want to assess for color, particles, any abnormalities, and any foul odors. And you're just going to discard that there. Next, we're going to reconnect our NG tube. Move it. I'm going to put my side rail back up. Turn on my suction back to whatever it was beforehand. I'm gonna drop the bed down to its lowest position while maintaining the 30-degree head elevation. Our next step, you're gonna wash your hands once more. Then you're gonna record your INO, and we're gonna give our patient our cowbell light. And that's it. That's how you take care of NG tube. Thank you.